So Wolfgang, lovely to have you here today and talking about a really quite a complex topic about diversity and inclusion and the role that well-being is playing in that. And I know you do a lot of work with organizations, and a big emphasis is often about talking to the business leadership, because it's got to start at the top. So when you are talking to these business leaders, how do you explain the importance of things like compassion, boldness, resilience to an organization, and then the role that well-being and diversity plays in this?
Yes, you're absolutely right. There is a challenge to explain to business leaders language like how compassion and boldness and resilience plays in their space and how it's related to D&I. And I like to sort of set the scene perhaps by referring to the current crisis, which clearly has been triggered by a health event, unlike previous recessions that were based, for instance, on a housing bubble most recently. So in this context now, I think we are reminded of what really matters in our lives, and health is on top of that list. When researchers ask people about what explains life satisfaction, they mention mental health first, incidentally, then quality of work and relationships, three really big themes. And the simplest answer I can think of to your question is perhaps to point out quickly a link between well-being and productivity. And the study that everybody knows in the UK is Britain's Healthiest Workplace, delivered by Vitality Health and Mercer, that shows that employers who prioritize employee health and well-being are up to 10.6 days, forgive me for the precise number, more productive per employee than those that have just average well-being programs. And you know, is that linked to compassion? We all know how much more likely we are to go the extra mile for an employer or even a colleague that shows us kindness and compassion. The other example that I often quote would be the research carried out by Google into psychologically safe teams, where people could bring their whole selves to work, and therefore the research found that they exceeded their targets by 17%. So it's fair to say that we could now be in a phase where organizations could turn adversity into opportunity, and employers are challenged to transform their workplaces in ways that genuinely allow people to thrive at work, in a way that will allow businesses and society to thrive too. Because for too long, we have been working, and work has evolved with little or no thought being given to the underlying people objectives, such as facilitating teamwork or reducing mental health issues. And, you know, a new form of leadership is also emerging, and leaders are really important. If you, for instance, look at the COVID crisis, compassionate leadership demonstrated by often female leaders of countries like New Zealand, Germany, Taiwan, or Finland, have shown that there is much to be said for decision-making based on the principles of care and benevolence. And this type of decision-making in philosophy is called ethics of care. It brings huge advantages, because when the group thrives, the individuals within the group thrive as well. And so creating a work environment around human beings also includes, I would argue, a fresh look at work-life balance. And work-life balance is not so much about a mathematical split between 49% work and 51% life, or the other way around, but it's about the integration of work and life around two existential themes, which are being able to work and able to love, as Freud put it so nicely. And that's what really matters. Does my workplace allow me to be successful in both? And again, the simple answer to summarize my response is employers should focus on being kind to their people, which means meeting people where they are, so that speaks to empathy, and taking them with them in terms of a shared purpose and focus.
That's really interesting, Wolfgang. So I know talking to employers, some of them will feel that that's the right thing to do, but to be able to do anything concrete, they need the data, they need to see where they are with their wellbeing offerings. So mean, how is it possible for them to audit their wellbeing offerings to see whether there are inequalities across various groups such as gender, age, ethnicity, disability, socioeconomic? What would your
Yeah,
advice be?
that's my favorite topic. How can you find hard data for what is very often misunderstood as a fluffy science of health and well-being and HR related D&I research? So let me try if I can make a convincing case for it. And I would say, particularly as a consequence of the crisis, most employers have now reached a crossroads of maturity where health and well-being at work is about to move on from those haphazard and uncoordinated programs based on anecdotal evidence. And the future is, strategic and evidence-based and based on meaningful data. So people shouldn't be afraid that there is a big data project coming their way. Big data is not needed, meaningful data is. And that approach is now moving fast into a joined up framework based on this data-driven assessment and benchmark data. It's also meant to be holistic. We need to start understanding employee needs by capturing various dimensions of well-being, including at least biopsychosocial aspects, plus financial well-being. And if you think about the EVP in the wider context, also purpose, trust, and a sense of belonging. And embedding health and well-being practices into the organizational culture, where concepts like good work and work-life balance play a key role. But very importantly, coming back to our theme, recognizing that health and well-being is a new frontier in the diversity and inclusion discourse, highlighting aspects of personalization and intersectionality. So ideally, what I want and what gets me excited is a multivariate data analysis. Sounds complex, but it isn't. It just means cross-referencing health data against performance data and D&I data. So for instance, I want to know, how does a young woman fare health-wise who had a good performance review? Because often health is a lagging indicator of other aspects of employment. So really interesting to see in which direction the correlation is going and what light it sheds on the sense of belonging and the success of the employment. And on that basis, organizations can implement then targeted and effective services that are D&I relevant. And just to justify one more time with data what can be done, one of our mental health pathway research that we have done with a client shows that a good pathway can reduce average cost of claims by nearly 10% and reduce absence by 41%, and most importantly, enhance therapy outcomes by 60%. And similar figures are available for all sort of evidence-based interventions in that space, like musculoskeletal diseases as well. So the approach of the future and the present, requires an integrated understanding of people's needs as human beings, including their intersectionality of their diversity, and also their financial well-being, sense of belonging, work-life balance, and how they derive a sense of purpose from work.
That is really interesting, Wolfgang, and this idea there isn't one default, that we actually are all different, and understanding that makes a difference to business. So thank you very much for spending your time today and answering those questions.
Thank you.